More than 100,000 people have died in Syria's civil war since it began in early 2011. That's according to the United Nations. Millions have fled the country or have been made homeless as a result of the conflict.
Now, leading doctors from around the world are warning the war is having a huge impact on the country's healthcare system. They say it's on the brink of collapse due to damaged medical centres and doctors having to flee.
Well, joining us now to discuss this is Dr. Talaat Atassi. Thanks very much for joining us. You're from the charity Hand in Hand Syria. I know, have spent a lot of time out there. Just give us your assessment of what's going on from the medical point of view for people in Syria.
Good morning. Just want to like to remind what is described now as civil war. It did not start as a war. It was civil demonstration which lasted for several months. From that point of time, the medical facilities and medical personnel were a target. And this is what we warned about from day one. Patients used to be abused and doctors used to be targeted and medical facilities be targeted from day one. And this is what really led to the current crisis, mostly in the current situation. I've been to Syria several times for the last 12 months. And I can tell you the situation is horrific. I'll give you an example. In a city like Aleppo, which used to have 5,000 doctors, now about probably 35 left over there, facing a huge crisis. Just people not only injured, now you've got the primary healthcare system in the brink of collapse. There is no children's doctor, no vaccination. And it's so frustrating for us from outside as doctors and for the doctors on the ground that they can't do anything. You got the patient in front of you and you can't help. It's so frustrating. What we look at is really would like to have more pressure on both sides, mainly on the Syrian government, to allow doctors to do their work freely, for patients to be treated fairly, and to have access to the medical facilities.
Dr. Atassi, can you give us I mean, I know you've spent quite a bit of time there yourself. You've been in that situation as a doctor, and you have children in front of you who need. Can you give us some insight into that? What does happen? What are you able to do or not able to do?
What you are able to do is too little, because we've got 5, 10 medical staff, most of them are not doctors, and suddenly you face up with 50, 60,000 injured people landing on the floor. Some places they have reasonable hospitals, others are working underground, and you have to choose who to treat. And you don't have a choice of what medication to give. Sometimes you have to take bloods from donors straight away without even testing the blood. In some places now, which is completely cut off, they don't have intravenous fluid. They use expired medication. But for me, I've seen children, really we can't do much for them, but from bandaging their wounds up. We take 3 people to operating rooms, and there is other 30 or 40 waiting outside. It's just so frustrating.
I'm looking at the letter that's been sent, and it's sent from a doctor in Homs, isn't it? He says, I'm a doctor working under siege, performing surgical operations in a basic hospital in an underground basement. He echoes what you're saying. The patients who need blood transfusions are given blood directly from the donors. I mean, so many very acute issues that both of you are talking about. Can the medical aid, if it were available, can it get to the doctors at all or not?
In certain parts of the country you can, particularly the one which is close to the borders. But there is particularly Homs and the suburbs of Damascus are completely cut off to the outside world. We can't even get them the medication they want, never mind the medical personnel. They can't transfer patient outside, and this is my main message today. We have to break that siege. We can do something. If the world managed to do something about chemical weapons, I'm sure they'd be able to do something to break that siege, to allow the humanitarian and the medical aid to get to those people.
Okay.
Dr. Atassi, thank you very much for your time this morning.
Thank you for having me. Thank you.